This video explains all about bladder care. I am joined here by my colleague Caroline to explain what you need to know.
How the bladder works. The bladder is part of the urinary system. This system manages the amount of harmful waste in the body. It includes the kidneys, ureters, bladder, sphincter muscles, and urethra. While the kidneys continue to work normally to remove waste from the body after injury, the bladder may not be able to release and store urine as it did before. The bladder is an organ with a large number of nerves, which collects and holds urine. When it is full, usually 400 to 500 mils, depending on your size, the pressure sends a message through the nerves of the spinal cord to the brain. This is a signal to empty your bladder. It causes a reflex action to squeeze the bladder wall, called the detrusor muscle, and completely empty the bladder. The sphincter muscle at the end of the bladder acts like a valve that you can tighten to keep urine from leaking. After a spinal cord injury, paralysis upsets normal control of the bladder. In the early days during spinal shock, the bladder will not squeeze because there is no muscle tone, which means the bladder is limp and unable to empty. During this time, an indwelling catheter inside the body is used to empty the bladder. This catheter passes through the urethra into the bladder, and a drainage bag is attached to the thigh or calf. How does spinal cord injury affect the way my bladder works? Neurogenic bladder is the name given to a number of urinary conditions in people who lack bladder control due to a spinal cord injury or other neurological problem. After a spinal cord injury, the bladder is usually affected in one of two ways. A reflexic bladder. If a spinal cord injury is at or above L1, the bladder will usually empty by reflex. As the bladder fills with urine, an automatic reflex triggers it to empty in a way that the person with a spinal cord injury cannot feel or control. With a reflexic bladder, you may not know when or if the bladder will empty. A flaccid bladder. If the spinal cord injury occurs at the L1 level or below, you will probably not have the reflex action to empty your bladder. The reflexes in a flaccid bladder are weak or absent, and if you cannot feel when your bladder is full, it may not empty on time. Autonomic dysreflexia. Bladder problems are a common cause of autonomic dysreflexia. This causes a sudden rise in blood pressure and can be dangerous. It can often be solved by emptying the bladder. What is bladder management? Bladder management is a set of treatments and methods to help keep your bladder and kidneys healthy and free from infection. Bladder management cannot fix or solve the problems caused by spinal cord injury. However, it can help you manage them to improve your health and quality of life. Effective management helps to prevent incontinence and damage to the kidneys. Whatever type of bladder function you have, the team at the NRH will develop a bladder program designed for you. Ongoing urology assessments will be carried out during your stay at the NRH if required. Clean intermittent self-catheterization. The most common method of bladder emptying is clean intermittent self-catheterization, or CISC, or self-intermittent catheterization, SIC, as it is also called during rehabilitation. You or someone else inserts a catheter through your urethra into your bladder to drain urine and keep your bladder from getting too full. The catheter is then removed and normal activities resumed. This is done as often as needed or recommended, usually 4 to 6 times per day. The goal is to keep the volume in your catheter less than 500 mils, or about 17 fluid ounces. So you may have to catheterize more or less often, depending on how much you drink. It means you will need to keep track of your fluid intake, so your bladder does not become overfull, especially when you are sleeping. Your CISC technique is very important, and nursing staff will help you get it right. Poor technique can result in trauma to your urethra, which can lead to hematuria or blood in the urine. or a urethral stricture, narrowing of the urethra due to repeated trauma. Poor technique can also result in urinary tract infections or UTIs. Indwelling catheterization. Indwelling catheterization involves a catheter and a urine collection bag that stays in place all the time. The catheter drains into the bag continuously. The catheter has a balloon at the tip which sits in your bladder. Indwelling catheters are typically changed every 10 to 12 weeks by your public health nurse, your GP, or by a family member if he or she has been trained. Some catheters require a change every 4 weeks, and if the catheter gets blocked, it may need to be changed earlier. Indwelling catheters carry a risk of urinary tract infections and bladder stones. There is also an increased risk of bladder cancer when the catheter has been in for over 10 years. Bladder stones can cause catheter blockages, leakage of urine, infection, hematuria, also known as blood in the urine, pain, and sometimes autonomic dysreflexia. Indwelling catheters can be either urethral or suprapubic. Urethral catheter. A urethral catheter is inserted through your urethra either by yourself or more commonly by a doctor, nurse, or a trained family member, using a similar technique as intermittent catheterization. However, instead of removing the catheter when your bladder is empty, the indwelling catheter stays in your bladder and is held in place in the bladder by a small balloon. A small tube connects the other end of the catheter to the leg bag. The collection bag must be emptied several times a day to keep it from getting too full. If the bag gets too full, pressure may build up and keep the urine from flowing down the tube. Instead, the urine will back up, and this can cause your bladder to become overstretched and cause problems such as infection, bleeding, or autonomic dysreflexia. Suprapubic catheter. A suprapubic catheter is also an indwelling catheter, but it drains urine from a small surgically created opening above the pubic bone and below the belly button. It carries the same risks as an indwelling urethral catheter. Because of its position, it can be more comfortable and cause less trauma than a urethral catheter. The management and care of a suprapubic catheter is similar to that of a urethral catheter. With a urethral or suprapubic catheter, bypassing of the catheter can occur. Bypassing is leakage of urine around the catheter. Or in the case of a suprapubic catheter, leakage can also occur through the urethra. This can be caused by bladder spasm, a blocked or kinked catheter, a UTI, or a bladder stone. You may need to take medication to stop bladder spasm and prevent urinary leakage. An external self-adhesive convener condom catheter used with a leg bag may be an option for men with reflexic bladders. A sheet is put on the penis and attached to a leg bag worn on the leg. The convene is changed daily and can be used in combination with CISCs, bladder infections, or urinary tract infections. People who use catheters of any type after spinal cord injury are at a high risk for urinary tract infections. Infections are caused by bacteria. The bladder is normally a closed and sterile area, but when you use a catheter, bacteria can easily get into the bladder and cause an infection. Bacteria are more likely to grow in urine that doesn't drain from the bladder. So if you cannot completely empty your bladder, the risk of infection increases. Some of the symptoms of a UTI may include a raised temperature, shivers or chills, cloudy or strong smelling urine, leaking around your indwelling catheter, increased spasms, leaking between SICs, or autonomic dysreflexia. UTIs may also cause a burning feeling while urinating and/or discomfort in the lower pelvic area or back. Antibiotics may be needed to treat these symptoms. If you develop any of these symptoms after discharge from rehab, you will need to visit your GP and have a urine sample checked for infection. Preventing infections. The key to preventing UTIs is to stop the spread of bacteria into the bladder. Careful hygiene and proper handling of catheters can help prevent infection. Sediment in the urine can gather in catheter tubes and make it harder for urine to drain and easier for bacteria to spread. Clean skin is also an important step in preventing infection. To reduce the risk of infection, wash hands carefully before and after catheterization, carry out toileting program or SICs on time, empty the bladder completely, keep catheter supplies and leg bag clean, drink 6 to 8 glasses of water a day, use the correct catheter size. If having trouble inserting a catheter, don't force it and contact your doctor or public health nurse or the urology department at the NRH. Medication for bladder management. You may need medication to help manage your bladder. An overactive bladder and urinary retention are the two main conditions where medication can help. There are many frequently prescribed medicines to help with these conditions. Some patients may need botulinum toxin injections into the bladder to help with bladder spasm, if tablets have not helped. This is something that can be discussed with the urologist, who will explain the advantages and disadvantages to you. Bladder management during rehabilitation. The best form of bladder management will be discussed with you by your medical consultant and rehabilitation team, as well as by the NRH urology department. Nursing staff will be responsible for explaining and showing you how to manage your bladder. Other members of your interdisciplinary team will also work with you on issues related to good bladder management. One-to-one education sessions will be held on the unit, and a patient information talk on bladder management will also take place on a regular basis. What is urodynamics? Urodynamics is a test carried out in the urology department at the NRH to see how your bladder and sphincter are working. A catheter is put into the bladder, which is then slowly filled with saline, and a measurement is taken to see how the bladder and sphincter respond. This test can help decide which bladder management option is best for you. Bladder management after discharge. Many people will need an annual urology checkup after discharge from rehabilitation. This will include a kidney and bladder ultrasound or scan, and sometimes an X-ray of the abdomen to check that the kidneys are working properly. These images can also check for kidney or bladder stones. If you continue to experience significant bladder problems at home, you should contact the urology department at the NRH, where advice, support, and alternative options will be discussed with you. If non-surgical bladder management options do not work for you over time, some surgical options may be suggested. Bladder problems after spinal cord injury can vary from a little leaking after a sneeze or laugh to a total loss of bladder control. Suggestions for managing problems, ranging from clever clothing options to surgery, can all be discussed on an individual basis. Following a spinal cord injury, maintaining healthy kidneys and a healthy bladder are important. There are many bladder management options. Your healthcare professional will help you find the best option for your needs and lifestyle. They can also help you decide when an option is working well or if a new option needs to be considered.